Bumabalik ang Doctors on TV. Nandito pa rin tayo at meron tayong caller na si Ruben Kayanan from Quezon City. Good morning, sir. Mr. Kayanan.
Hello, good morning.
Good morning,
Good morning.
po. Ano pong katanungan natin, sir?
Itatanong ko lang po kasi I am diabetic. Kaya lang na-notice ko sa left foot ko na yung mga veins parang medyo na parang may naipon pong dugo. I would like to ask if there is a scanner na pwede kong malaman if it's an accumulation of blood, or is there something that I could take para hindi ho maging ganun ang paa ko. It's different from the other foot, kaya ganun.
Okay. Yes, there are scans to check the blood vessels in your legs. We call them the arterial duplex scan or the venous
duplex scan.
or the venous duplex scan. Arteries refer to blood vessels that are bringing blood towards your feet, and veins are the blood vessels bringing blood from your feet back to your heart. Nasa scan yan, ultrasound lang yan para makita. There are patients who do get blood clots in their legs. There's a chance na pwede yan nga nangyari sa inyo. These blood clots can be dangerous because they can travel from your legs up to your heart or your lungs, kung saan magbabara naman sila dun sa lungs niyo. There are medicines para gawin malabnaw ang dugo para maiwasan yung pag-clot sa paa.
Doc, lahat ba ng major hospitals merong ganong tests?
The bigger hospitals probably have them. So arterial and venous duplex scan of your lower extremities.
Ayun, Mr. Kayanan, pwede tayong pumunta sa ating mga hospitals to get the scan. Yun lang po ba yung katanungan natin, sir?
Okay,
Ay,
baka
nawala na. Salamat po sa inyong tawag. At sa mga gusto pa pong tumawag, open po ang aming mga linya. At sa mga gusto mag-text, ay open po yung aming mga linya din. Ayan.
Okay, so we have another texter, no? Ang tanong niya is, ano po ba ang epekto ng mga diabetes supplements, no? On diabetes, effective daw ba sila?
Okay, there's some data coming out for supplements, and there's emerging data, no? There's a large pool, especially for chromium and some other supplements, although they're still not standard therapy. So do not forgo the prescription of your doctor in favor of the supplement. They're just meant to be complementary. They may help control your blood sugar better, but as add-on to your diabetes medication.
So complement, they should work hand in hand.
It's not like it will replace na tatanggalin mo yung mga gamot mo sa diabetes, baka tamaas ang blood sugar. We don't have the exact data on how many people will respond to these supplements kasi and how strong their effect is. So as complementary medicine, yes, okay lang.
So kung, for example, no, meron ka, yung family mo may predisposition to diabetes, posible ba, Doc, na pwede tayong gumamit ng supplements to prevent naman? Sa tingin ninyo?
I don't mind, but I think our most of our studies are generally in patients already with diabetes. So I'd still prefer that if you're diabetic, that's when you might want to try it on top of your normal medication.
Ayun, ayan.
So pwede naman siyang i-take, no? It won't harm you naman, pero dapat nagpapa-check up pa din, tapos iinumin pa rin yung binibigay ng doktor.
Na-mention mo, Doc, kanina yung chromium. Is this ba in the form of chromium picolinate?
Yes, chromium picolinate has some studies on controlling blood sugars better.
Okay. So, ano yan, given na talagang chromium picolinate ay nagko-control ng blood sugar.
Okay, I think you're used to using chromium also in your practice.
Marami kasing supplements na may chromium picolinate actually.
Alright.
Not just chromium picolinate, but manggagaling mismo doon sa isang supplement so that yung kanyang bioavailability ay mataas.
Maganda.
Okay.
Doc JM, how about yung ampalaya?
Okay, ampalaya, a few years ago, they were doing studies in the University of the Philippines. They found that a dose of 100 milligrams per kilogram per day was just as effective as a certain tablet for diabetes. But the dose is high, 100 milligrams per
mga ilang
kilogram.
ampalaya.
That means if you're a 60 kilogram person, you'd have to take about 6,000 milligrams of ampalaya for it to be effective. If you buy it in capsule form, it's about 12 capsules,
Mataas.
which might come out to be more expensive than that one tablet for diabetes, which is effective. But I think they're doing more studies on ampalaya lately, so we're hoping it might come out as a good supplement. Ampalaya is known as Momordica charantia.
Yes, charantia. Actually, kapag maganda naman ang quality ng ating process, manufacturing procedure, kaya nating mag-extract ng ganun kataas. Pero itong diabetrol, ay meron din siyang component, Doc JM, ng chromium picolinate.
Oh, okay.
So nasa 200 microgram ito. So I guess, no, lahat tayo nag-agree naman na mahusay naman sa diabetes yung chromium picolinate. Ayan, so diabetrol.
And don't forget the standard therapy. Kasi standard therapy will include, of course, more the lifestyle is very important. Diet, exercise, weight loss, smoking cessation, stop smoking if you're a smoker, alcohol, avoidance of alcohol, and of course the pharmacological treatment.
Yes.
Most patients will not be able to control their diabetes with lifestyle changes alone. You'll really need to take medicines for your diabetes.
Tsaka of course, no, may mga supplements ay kagaya ng diabetrol na nagtataglay din ng iba pang components na makakatulong din sa pag-lose ng weight actually. So na-mention nyo,
And I
Doc
think-
JM, yung mga risk factors na yan, mape-prevent din niya yung mga risk factors na mag-set in. Yan.
Like
So
obesity,
mahusay.
very important.
Very important.
Okay. And something we have to understand is that diabetes is a progressive disease. It gets worse over time. Some patients kasi, they take medications and they exercise, and then pag nakita lang maganda ng blood sugar nila, pwede na ako kumain ng marami ulit. Na maganda ng
Hindi
sugar
pwede.
ko. Babawasan ko na yung gamot ko kasi maganda ng sugar ko magaling na ako. Actually, hindi. Diabetes gets worse over time. So if your blood sugars are controlled on your current medications, wag mong babawasan. Kailangan ituloy kasi it might get worse over time. And some patients in their first few years need 1 tablet. After a few years, they need a 2nd tablet na. After a few more years, another tablet, 3 tablets. And if you fail on 3 oral agents, then you go to insulin. Okay? And wag kayong matakot sa insulin. Insulin is a very well-known therapy for diabetes. It's been around for almost 100 years na. It's the oldest medicine that we have for our diabetes. Wag kayong matakot sa insulin.
Okay. So, Dr. M, we have another phone-in question from Mark. So, let's say, nagtitake na ng mga conventional medications. Pwede daw ba isabay ang mga supplements sa kanyang mga gamot for
Yes.
diabetes?
Generally, yes. There are no known drug-to-drug interactions with our supplements and our conventional medication. But
So
again,
it's
don't
all
don't forgo your conventional treatment in favor of your supplements.
Ayun, oo. Ayun.
Okay, so pwede, no? So baka yung mga supplements natin may help, no, na control, baka mapababa ng konti yung dose ng ating mga traditional medicines, pero pwede siyang i-take together. Okay, so we're having a very interesting discussion, no? Baka may mga tanong pa, pwede nyo pang ihabol, no? Pagpapatuloy natin ang ating discussion on diabetes, and let's pause for a break.